بسم الله الرحمن الرحيم. أنا دكتورة بسمة سالم، مدرس مساعد في قسم طب المناطق الحارة وجامعة اسكندرية. النهارده هنتكلم على how to palpate the liver. How to palpate a liver is a common spot in the exams, and it's come in two ways. Either palpate right lobe of liver or palpate left lobe of liver. Now we're talking about everything and how to examine the liver in general. First, we have to do superficial palpation. Before doing superficial palpation, we have to know what's meant by abdominal regions. We are divide the abdomen by a line coming from the subcostal margin, like that, this line, like that, and another line passing from the anterior superior iliac spine, like that. And the two vertical lines from the clavicle, we're taking a line, vertical, and another line from the right and the left. To divide the abdomen into 9 regions. This is called left hypochondrial region, epigastric region, right hypochondrial region, right lumbar, umbilical, left lumbar region, left iliac fossa or left inguinal region, hypogastric or pubic region, and right iliac or right inguinal regions. This is very important at the start to do the superficial palpation. How we can do superficial palpation? By palpating the 9 regions. Starting from anywhere, either from the left iliac fossa, doing like that. Just do a light pressure, or from the right iliac fossa, doing S-shaped, either doing like that region, whatever. The most important that the tender region, we have to do palpation at end. After we end the superficial palpation, there is no spot in the exam called to do superficial palpation. It is the starting of any palpation of any organ. We should start with a superficial palpation. What is the importance of superficial palpation? First, to gain the patient confidence. Second, any area of change temperature, we can feel it. Any area of tenderness by doing the superficial palpation and my eye on the patient. To express or to know the facial expression of the patient. And to detect any area of rigidity. What's meant by rigidity? It's involuntary contraction of the anterior abdominal wall. The voluntary is called gardening. This is involuntary. Involuntary by this is relaxation all over the abdomen, and this is area, yes, I feel rigid until it, or something hard under my hand. This is called rigidity. That means that there is disease, the viscous under this area. That's why the anterior abdominal wall muscles contracted over it. Then we will palpate the right lobe of liver. We're starting from the right iliac fossa and we do deep palpation. That means I do pressure inside and outside. And ask a patient to take a deep breathing. والنفس وطلعه كده. طلعه. After exhale and before the inhalation, I'm pressure my abdomen. And again. تاني كده. And then pressure my abdomen. Again. I feel something like here. After I feel something here, something hard or firm, whatever is the consistency, there is a change in the consistency under my hand. I'm stopping my hand and I'm detect now the site. The site we are talking about the right hypochondrial region at first. Number second, the size. How I can examine the size? Either palpation finger or by centimeters. We will do it here by the patient fingers. We feel the costal margin of the patient. It's here. I'm asking the patient to put his hand. I'm just counting them, 1, 2, 3. So the right lobe of liver is 3 fingers below the costal margin. But now we are comment on the side and the size. There is a lower border of the liver. I'm just moving my hand on it. I feel it's a sharp border. Maybe it's either rounded border or sharp border or irregular. The rounded border, this has happened in the fatty liver on the normal. The sharp border occurs in liver cirrhosis, and the irregular occurs in malignancy. Now we will detect on the surface. I'm moving my hand on the surface to detect it is a smooth surface, which is in the normal, or in the fatty liver, or either it's a nodular. That means my hands is coming out upward and downwards because there is a node over the liver. This occurs in liver cirrhosis and HCC and metastasis. And the consistency, here the consistency is firm inconsistency. The consistency will be either soft inconsistency, which occurs in normal and in fatty liver, firm inconsistency in liver cirrhosis, hard inconsistency in case of malignancy. And now I'm examining if it's tender or not. No, it's not tender. The patient don't have any facial expression of tenderness at all. So we have comment until now, according to the site, in the right hypochondrial region. The size is 3 fingers below the costal margin. The lower border is sharp border. The consistency is firm inconsistency. The surface is smooth surface and is not tender. Lastly, we have to examine in palpation the hepatic pulsation. How can I examine them? By manual palpation. I'm putting my hand under the patient, on the back of the patient, and I'm pushing inside. I'm do pressure on the liver. I'm feeling if there is any pulsation in the liver or not. Here is not pulsating. Okay. This is how to examine, how to palpate right lobe of liver. In the spot exam, it's examine. We have to do percussion to detect the upper border of the liver. This is the Lewis angle. The space in front of it is the second intercostal space. We're starting by percussion. Here the change in the nodes into dullness. Okay, ask the patient to take a deep breathing and stop it. والنفس واكتمه. اكتمه بقى. This is the resonant. That's indicate this is the upper border of the liver and this is the lower border. I can measure it to do the liver span. The normal liver span is 12 to 15 centimeter, and this is indicate that the liver is movement with respiration. This is the full comment on the liver. طلع النفس خلاص. This is a normal comment on the liver. How to examine right lobe of liver. Comment on the site, size, lower border, surface, consistency, tenderness, liver pulsation by bimanual palpation, and examine the upper border of the liver by tidal percussion. How to examine the left lobe of liver? We are starting from the epigastric, so from the pubic region. The same. I'm doing deep palpation until I feel something here that indicates this is the left lobe of liver. The same comment. This is the site in the epigastric region. According to the size, give me ايدك حطها بقى كده. This is a sternum. 1, 2, 3, 4. This is 4 fingers below the costal margin. The lower border is sharp border. The consistency here is firm inconsistency. The surface is smooth and it's not tender. And of course, it's movement with respiration. My hand is moving. This is how to examine the right lobe and left lobe of liver. Common asked questions on the liver. First, what is the cause of hepatomegaly? We're in the tropical medicine, so we should start with the infectious causes. We can divide the infectious causes either to viral, bacterial, fungal, so protozoal or parasitic. First, the viral. Of course, we have cytomegalovirus, Epstein-Barr virus, or hepatitis viruses. It's very important, either hepatotropic viruses or non-hepatotropic viruses. Hepatotropic viruses like hepatitis A, hepatitis B, C, D, E. Either non-hepatotropic, the cytomegalovirus, Epstein-Barr virus, and herpes simplex virus. Bacterial, like typhoid, Brucella, Shigella. Protozoal, like malaria and visceral leishmaniasis, which is called Calazar leishmaniasis. And parasitic, of course, the very important for us, schistosomiasis. The second cause is congested causes. Congested, this means there is an obstruction in the venous return of the liver. There is 3 hepatic veins, right, left, and middle. There is ended in the inferior vena cava, which end in the right atrium. Either obstruction in this pathway leading to congestion in the liver, which end leading to hepatomegaly by Budd-Chiari syndrome or Budd-Chiari syndromes, which mean obstruction of the hepatic veins by thrombus, hepatic vein thrombosis. Inferior vena cava obstruction by thrombus, by tumor from outside, or right side heart failure, congestive pericarditis, either these causes. Of course, it's very important cause, it's malignancy. Malignancy in the liver, it's very important. The liver is a common site for metastasis, so it's number one. Number two is hepatocellular carcinoma, which occurs on top of liver cirrhosis. It's a very common complication of liver cirrhosis, and it's very important nowadays. Number three, there is a metabolic causes, like hemochromatosis, which means deposition of the iron inside the liver. Wilson, which is mean Wilson disease, deposition of the copper inside the liver. Glycogen storage disease, deposition of many substance, according to which is the enzyme is defecting in the Krebs cycle, leading to deposition of the substrate behind this enzyme defect, leading to deposition in the liver, leading to glycogen storage diseases. There is other causes. Biliary obstruction, leading to bile accumulation inside the liver, leading by the end by hepatomegaly, like cancer head of pancreas, gallstones, whatever, leading obstructions. This is the most common etiologies. There is a lot of etiologies in your book. This is the most commonly. We will talk about what is the cause of pulsating liver. If I'm doing the bimanual palpation and I feel pulsating liver, what will be the cause? The other hepatic causes or cardiac causes. The hepatic cause like pulsating hepatocellular carcinoma, hemangioma, arteriovenous malformation, hepatic artery aneurysm. The cardiac cause, which is very important, tricuspid regurg. We should think about it very importantly. What is the causes of hepatomegaly? Can cause tenderness, which is a cause of tender hepatomegaly. First, the infectious causes, the viral, the bacterial, amoebic hepatitis, amoebic liver abscess, biogenic liver abscess, typhoid, brucella, which is very important, which we should think about congestion because it causes stretch in the glycan capsule, which is the capsule around the liver, can cause pain, and the late HCC or late malignancy or late hepatocellular carcinoma. We think about tenderness inside the liver or tender hepatomegaly. Of course, if there is a gallstones or obstruction in the biliary system, it causes right hypochondrial region pain. So when I do palpation, I will feel pain in these regions by biliary obstruction. Okay. Now we will talk about hepatojugular reflux. Hepatojugular reflux, what mean by it? We are detect the correlation between the liver or between the intra-abdominal pressure generally and the internal jugular vein or jugular veins in the neck. If the patient is lying flat, we will see that the neck veins is congested. Here the patient is standing 45 degrees, which is we can elicit the test. If the patient is lying flat, the neck veins is congested, so we can't correlate between the relation between the liver and the jugular veins. So we are putting the patient or setting the patient on 55 degree and look for the neck veins. We should make sure that it's free at all, and we can do a pressure on the liver like that. We will see here in the neck veins. What we normally see when we do a pressure, normally the liver will free the blood from it, and it will go to the inferior vena cava, it's in the right side of the heart. There is certain pulsations or there is certain increase or transient increase in the intracardiac pressure, which take time to adapt with it. So we can see in the neck veins there is less than 3 centimeter increase in the congestion of the neck veins. Normally it's free and it's transient, not lasting for a long time. If it's lasting for a long time, they indicate that the heart can adapt with the increase of intracardiac pressure or intrathoracic pressure. This occurs in right side heart failure. This test cannot occur, which is absent at all. When I do pressure, I don't see any transient increase in the pressure or the colons in the internal jugular vein. This is occurred in Budd-Chiari syndromes or inferior vena cava obstruction because the pathway is already obstructed. There is no place for the blood to be moved from the liver to the heart. Thank you.